This is Carol. Carol is very active and exercises regularly. However, she's been experiencing chest pain during her recent workouts. So she decides to visit a doctor. After listing her symptoms, the doctor tells her she is likely experiencing angina pectoris. Confused and concerned, Carol asks the doctor, "What is angina pectoris?" This was the doctor's response. Angina pectoris is the term used for chest pain due to myocardial ischemia, or in other words, the muscles of the heart are lacking sufficient oxygen because the arteries that supply them with blood are occluded. Ischemia is common in patients with atherosclerosis, in which a buildup of plaque partially or completely blocks the coronary arteries, limiting the amount of oxygenated blood getting to the myocardium, and therefore the heart must work harder to meet the tissue's demands. The doctor then informs Carol that in order to identify her condition, the doctors will have to run some tests so that they can determine the best treatment strategy, since there are three main types of angina.
The first and most common type of angina is stable angina. Stable angina can be brought on by physical activity or emotional stress, as in these states the heart works harder and requires more oxygen. Pain symptoms will usually subside as the heart's demand for myocardial oxygen is lowered. The second and more serious type is known as unstable angina. The difference between unstable and stable angina is that pain symptoms aren't limited to periods of physical activity or emotional stress, as they can also occur when a person is at rest. This is because the coronary arteries are so occluded that the heart's supply of oxygenated blood isn't enough even when the body is at rest. The third type is a rare form known as variant angina, which is caused by spasms of the coronary artery that narrow and constrict the vessel. The underlying mechanisms for this have not yet been fully determined. However, scientists suggest that endothelial dysfunction and enhanced vascular smooth muscle contractility play a key role.
To distinguish the various types of angina, there is a whole host of different tests and imaging techniques doctors can perform to aid in their diagnoses. In angina pectoris diagnoses, the most common test performed is called an exercise stress test. Patients will be asked to perform some sort of physical activity, like walking on a treadmill or riding a stationary bike, while hooked up to an electrocardiogram so doctors can analyze and evaluate the heart's performance with activity. An electrocardiogram, or an ECG, is a key test performed in most cardiac disorders. The squiggly green lines running across the screen are traces of the electrical activity in the heart seen from different locations. Interpreting ECG traces is a complicated task, and in angina pectoris, a doctor may notice changes, particularly in the ST segment of the ECG. The elevation or depression of the ST segment is characteristic of a lack of oxygen or blood to the tissues, or as previously mentioned, myocardial ischemia. Further possible testing may include blood tests, where doctors look for elevated levels of enzymes, lipids, or other substances like cholesterol, triglycerides, and troponin, or echocardiograms, which use high-frequency waves or ultrasounds to produce moving images and illustrate wall movement and blood flow. Finally, in a technique known as coronary angiography, the doctor injects a fluid called a contrast agent directly into the coronary arteries by inserting a catheter with a needle into a blood vessel in the groin and guiding it all the way up to the heart. When viewed under an X-ray, this contrast agent appears dark as it flows through the arteries and reveals any narrowing or blockages that may be disrupting normal blood flow. Luckily for Carol, the doctors were able to diagnose her condition with just an exercise stress test, and she avoided the more invasive testing. Fortunately, the doctors say she has stable angina, the most common variety, and also the easiest to treat. Carol's symptoms are not extremely severe, so surgical treatments like angioplasty can be eliminated. The doctor prescribes her a quick-acting nitrate drug called nitroglycerin and instructs her to take one tablet before her workouts or whenever she feels chest pain. Nitroglycerin works to open the coronary arteries in a process called vasodilation. The expansion of the blood vessels will allow for proper blood flow and oxygen supply to the heart muscles during exercise. The doctor also suggests some lifestyle changes for Carol, since in their first consultation, Carol exposed some bad habits to the doctor that are obvious risk factors in her condition. Although Carol appears healthy and is not overweight, she tells the doctor she's a regular smoker who doesn't have a lot of time to cook for herself, so her favorite food is McDonald's, since it's conveniently on her way to work. And her father suffered a fatal heart attack only 2 years ago. Because of these pre-existing risk factors, Carol's condition can worsen in the near future, so the doctor heavily recommends she quit smoking, moves to a well-balanced home-cooked diet, and continue to exercise at least 150 minutes per week to prevent any complications like a heart attack.
Now that Carol has all of the information about angina, she is no longer confused and now understands the changes that she needs to make in her life in order to manage her condition, angina pectoris.